Our second panel today is a discussion about care supports. So this is another huge topic with many, many moving parts, and I'm sure, again, could be a conference all on its own. But for example, there's a need for flexible, accessible, inclusive care supports from birth to 19 years of age for many of our kids. $10 a day daycare, for which many of our kids don't have access, especially those with medical complexity. Before and after school care, nursing support worker funding, and respite. These are all interwoven considerations. There's currently a bill, Bill C-35, an act respecting early learning and childcare in Canada, which just completed consideration in committee in the House of Commons. Many of us feel that bill doesn't go quite far enough in terms of defining inclusion and inclusive learning when it comes to children with disabilities who may have substantial barriers to inclusion. So let me introduce our panelists who can certainly grapple with these issues and more. Their bios, again, can be found in the link in the chat. David McDonald joined the Canadian Centre for Policy Alternatives, CCPA, as its senior Ottawa economist in 2021. Since 2008, he has coordinated the Alternative Federal Budget, which takes a fresh look at the federal budget from a progressive perspective. Dr. Erika Cedillo is the Director of Public Policy and Programs at Inclusion BC, a position she has held since 2020. And Eyal Cohen is a Professor of Pediatrics and Health Policy, Management, and Evaluation at the University of Toronto. He co-founded the Complex Care Program at Sick Kids and serves in a number of advisory roles. Our moderator today, who I don't know if I'm just missing on my screen, is Brenda Lenahan. There she is. She is not only my co-convener, she is a mom to a young son with health complexities. He inspired her involvement in advocacy and research. She co-founded the grassroots group BC Complex Kids and was appointed to the National Advisory Council on Early Learning and Childcare and the Minister's Advisory Council for Children and Youth and Support Needs in BC. We'd like to just remind you to use the chat box to share your thoughts and what's bubbling up. It will just go to the host, but we will be collecting those thoughts and any questions. And I will now hand it over to you, Brenda.
Thank you, Amanda. I'm really excited to be here with everybody today. This is a topic that's very close to my heart, and I see care supports. We intentionally called it care supports instead of just childcare because for me it extends with the families that I see, and for my family, this means everything from childcare in the early years, extending up through childcare for before and after school care all the way to the age of 19. And it also includes nursing support. Some children need a nurse with them full time. Some children need a nurse to watch them sleep at night so their parents can sleep. Our families also need respite. That's a break for parents from caregiving. And we, of course, need childcare like everybody else in the early years so that we can work. And so I'm very excited to have this discussion and tie this together with this group today. We are going to start with David, and we are going to, everybody's going to have about 4 minutes to share their initial thoughts and perspectives. Thanks, David.
Great. Well, thanks so much for the invitation to speak to folks today. I have certainly been looking at childcare broadly for a long time, in particular at childcare fees, but also at childcare access, broadly speaking. And so I think that for most folks who've been following the childcare file recently, it's pretty clear that fees are dropping, and they're dropping pretty substantially across the country. The CCPA has been tracking fees in Canada since 2014 across 37 different cities. And so we make about 10,000 phone calls a year to track those fees in individual cities. And so we have seen a massive reduction in fees in the neighborhood of 50%. That was the goal at the end of 2022. That's not always the case in every city or in every province, but that's broadly what we're seeing. Sometimes they're a little short, sometimes they've actually exceeded targets. And this is in line with the federal plan, the Canada-wide Early Learning and Childcare Plan, which is projecting a 50% reduction in fees by the end of 2022, which has already happened, moving towards $10 a day fees by 2025. That program seems to be well on. Is reasonably difficult to get it up and running. Childcare advocates have been advocating for more affordable fees in Canada for decades, and this is the first time it's ever really happened across the country, although certainly some provinces have had much more affordable fees, notably Quebec, although it's not the only one, for several years. Now, the other part that's much harder, frankly, is a discussion about wait lists and accessibility. And so it is absolutely critical that fees come down to make childcare services more affordable. The trouble now is to get the full benefits of those more affordable fees, we have to have people have the ability to access them, to actually be able to find spaces, to not be in endless waiting lists, to not put their kids on a waiting list when they come back with a positive pregnancy test, which is sometimes the case in some provinces. And so that, I think, is where we're at now. The fee declines are well underway. Sometimes we think of the construction of spaces in a physical sense, the sense of capital, and that's certainly true. You do need to renovate spaces so that they meet standards for having children in them. But one of the more important pieces that's underappreciated is the need for competent staff to staff those spaces long-term once you build them. And so, that sometimes comes up with a debate around, having the correct training, and that's certainly true. There's a lot of people actually that have early learning and childcare training. The trouble is they don't stay in childcare jobs for very long once they realize the pay is low and they're sort of lousy jobs, often part-time, with poor hours and poor quality of life associated with them. So, there can be substantial economic benefits to a more affordable and accessible childcare system. We've got the affordability piece in place, but we need the accessibility piece in place. Those major benefits generally come from much higher labor force participation. This is particularly true for women, and certainly one of the things that was seen in Quebec when they introduced their much more affordable plan in the 1990s. But you don't get that unless there's actually spaces for people to put their children in, and therefore you get more people working, more people paying taxes, and higher economic growth as a result. And so, when it comes to having enough spaces, childcare deserts, which is what we've called them in a 2018 report, and actually another report that's being released on Tuesday, are widespread. So these are postal codes with more than 3 children per licensed space. And we're primarily looking here at children that aren't eligible yet for public school. So they're not in kindergarten yet or not of kindergarten age. These childcare deserts are widespread in almost all provinces outside of Quebec and Prince Edward Island. And they're much worse in rural areas and smaller towns than they are in big cities. And even in big cities, childcare deserts are much more prevalent in suburban areas than they are in downtown cores. And so that's very much a broad overview of sort of the big issues in childcare right now. So I'll hold it at that, and I look forward to your questions.
Thank you so much, David. Yeah, I was just thinking as you're talking about wait lists, I know for some families, being waitlisted it might be the only wait list they're on. And for many of our families, I just wanted to share, we're on wait lists for everything, for every type of service, for early intervention, for respite, for childcare. Yeah, we're waitlisted always. We're always deprioritized as well in childcare. And I was thinking about the accessibility piece. I know access right now in the federal discussion is about people being able to access a spot, but for our kids, sometimes it's literally about getting in the door. We need accessible, universally designed spaces as well. So it's certainly interesting to hear the national discussion on childcare and then relate it to all the other barriers that land on our laps as families of kids with disabilities. I am now going to pass it over to Erika. Thank you, Erika.
Thank you so much, and good morning, everyone, and good afternoon in other parts of the country. Thank you for my role as Director of Public Policy and Programs. I mentioned quickly for those who are the first time who hear about Inclusion BC, we are a provincial federation of members who are working and advocating for the rights and opportunities of people with intellectual and developmental disabilities and their families. We are based in British Columbia, and we are part of a national federation who is Inclusion Canada, advocating for the same. We are part of a major movement, a global movement, because it goes up into Inclusion International, also inclusive lives and opening more spaces. And this topic about care and childcare, and which I totally agree, Brenda, childcare is just one element of care, and that is very important to not lose sight of for families who have a child with a disability or other support needs. And in planning for this, I wanted to share a bit what is like the guiding part is what is needed is the real inclusive childcare, and the reasoning to why is very important to not lose sight of that. Early childhood as a critical stage of development, identity forming for all children. And that is true as well for children with disabilities. And although the challenge is that they are denied of so many opportunities to make this a reality for them as well. When David was talking about access, and when we look into what is needed I would see it into three main points, which is access, participation, and support. The access is just getting through the door, which we finding the spaces where this is possible. But for a child with a disability, is that setting is prepared to welcome them. And then once you get through the door, is what your participation looks like, right? And it is not like this is the group of children, and that is the child who needs the supports, and it's someone else's job to do and make sure that they are included. Inclusion is how we all come together, and that participation becomes a meaningful participation with a child, and the family can develop those networks and connections of support. And the third part about support, that is the underpinning of all this into what is needed. Yes, some children will need more support than others, and that is what we want to see happening, that there's a way to make those available in any part of the province and the country where a child needs access. Some of the work that I've done, or that we kind of support each other with my colleagues across the province, I can highlight the work from New Brunswick, where they have worked very diligently in supporting the organization. What we well in British Columbia is how we build a capacity in all childcare centers, so that this is not only the responsibility of a few, but a shared responsibility, because this responsibility is shared across society. Like, we want all of our children to be able to grow up and meet their potential and expand it as much as they can, to be a good citizen and a contributing member of our society just by the fact that they are a person. And in talking about what Bill C-35, in all this, and the challenge is that inclusion still is an optional thing. So what we are looking and aspiring for is that we will have, as a country and in every province, a legal framework that will ensure that inclusion is as mandated as inclusion in education, right? That it's not an optional thing. Not that childcare can say like, your child needs a lot of support. I'm sorry, we cannot. Next person, right? Yeah, it's a very needed service and support for all parents, and children who come with additional needs, you're really discriminated against by the fact that they have additional needs. So the hope that I see in these in Bill C-35 is the possibility of having a framework that legislates inclusion, and that with that will come the resources that would make sure that this happens. And that involves the training of the staff, the right compensation, the facilities that are designed for that, a ratio that is feasible for a childcare center, and that this is available from 0 to 19. And this is a conversation that Brenda and also break the assumption that a child only needs childcare until they are 10 or 12 years of age. Some of our children in our country, they need the support further and longer, and we need to respond as that as a society. So, so what the progress of Bill C-35 is not as hopeful. There is the two elements that made it into the community process, at the level of committee, is that the guiding principles are talking about including children with disabilities, and the annual reporting is about making sure that accessibility and inclusiveness are also reported on. There are minimal gains, and the challenge that we see now is that inclusion somehow in the discourse, when we're talking about equity, diversity, and inclusion all across sectors and places, somehow disability has been dropped. So now we have to say this needs to be disability inclusive. And just think about how that is. Like, we need to be labeling again certain specific way of experiencing life to make sure that you participate. I think that's not what we want to see. So meaningful inclusion for all children with the right supports when their family needs them. I'll leave it there. I'm happy to continue in the later questions.
Thank you, Erika, and thank you for touching on the legislation there. Yes, we really also want to see the rights included in the purpose, the disability, the UN Convention on the Rights of Persons with Disabilities. We really would love to see that embedded in there. We really need it to be there, and yet unfortunately here we are. We're having to actually fight for that right now, and we were even felt excluded from. We were excluded, all of us, from the recent committee witnesses that were called. None of our organizations were called to speak, which was really disheartening, but we won't give up on that. That's for sure. And thank you for bringing forward the discussion about inclusion and what that can look like. I did have an opportunity when my son was young to have inclusive childcare for him before he started school, and that I was lucky is how I look at it. It was very unusual for a kid like mine to have that opportunity, and it was only a few days a week for half days. So we definitely need to do better. Now I'm going to turn it over to Eyal. Thank you for being with us. And he's going to bring a little different perspective to this conversation, I think.
Thanks, Brenda, and good morning to those on the West. Good afternoon to those on the East. And thank you, David and Erika, for your insights. I'm going to try to complement those from the perspective of where I come from, as primarily as a pediatrician, a clinician, and someone who studies the way our health system in particular is constructed. So I'm going to try to absorb the insights that you presented on public policy, inclusivity, human rights that are so critical to all of this, and also reflect on learnings, hopefully, from the larger group who have lived experiences in this space as well. So my work is involved with the care of children with medical complexity and supporting them and their families. So for those who aren't aware of that term, these are children who have both disabilities as well as intensive medical needs. Examples of things like this could be being on home ventilation, requiring a feeding pump, the need to deliver various forms of therapy or medication multiple times a day. Many of these children need round-the-clock, eyes-on care to keep themselves safe. And this caregiving role is largely taken up by a workforce of unpaid family caregivers. And this role is disproportionately taken up by women. A report came out this week on caregiver labor from Statistics Canada that estimated that replacing the contributions of unpaid caregiving by employed caregivers would be in the order of $50 billion per year, which represents 3 times what we spend on home care and long-term care in this country. So I'm going to focus before our panel, I think, really highlighted that. But the impact of what happens when care are isolated, marginalized, or unsupported is profound. My research team has studied this in a variety of ways, and the data are quite sobering. There are impacts on income. Families of these children get poorer over time compared to families with children who do not have complex care needs. There's impacts on caregiver mental health, isolation, sleep disturbance, post-traumatic stress, and many other issues. And there's impacts on caregiver physical health, not just from the direct aspect of caregiving, like musculoskeletal problems from lifting and transferring when there are inadequate accommodations, but even impacts from chronic stress, such as on cardiovascular health and even, sadly, premature mortality. And the other important piece of research I want to highlight as a pediatrician is that even if I take the narrowest view of my job as possible, that I look after kids and not their parents, we know definitively from many studies that successful outcomes for children rely on optimal outcomes for caregivers. And successful support for caregivers is inextricably linked to success for children. So what do I think is important consideration on how to best support caregivers? Just want to highlight a few high-level items. The first one is I think we need to focus much more on the child in family as the unit that we target. Our systems are so siloed in many ways that still is a struggle. We have pots of money and various services for children with disabilities. These are in many ways inadequate, but at least they exist. Less commonly, we have some services and resources to support families, but they're often divorced from the needs of the children as it relates to the family. There's a lot of rhetoric bandied about in healthcare organizations about family-centered care, that families are at the center of everything that we do. But when we actually assess what that means in reality, it's often reduced to a misguided operationalization that focuses solely on family autonomy. Essentially, what happens is unpaid caregivers are being asked to do more and more to replace paid caregiving support. So rather than sending in a nurse to support care for a particular piece of technology for one of my patients, or we teach families to do it without always taking into account the unpaid caregiving, the additional stressors, and other impact that entails. The second thing I want to highlight is the concept of a life course approach. We need to provide supports that incorporate the journey over many phases and transitions for caregivers. And I think this came out in some of the comments about childcare. I'll give an example. A number of years ago, I was asked to advise the federal government on a new benefit for critically ill children. The benefit was meant to be administered for a year after the critical illness or injury. And this was in many ways a good thing. But the issue is that oftentimes the greatest need isn't right after the quote unquote catastrophic event that this benefit is meant to support. If it is a newborn, for instance, families may already have access to parental benefits. Often it is in different phases of the life course that caregivers experience the biggest stresses and financial needs, such as transition from hospital to home, home to school, pediatric to adult care. And this has been shown empirically in research. It is often during these life stages that families experience the most financial strain and underemployment. The third thing I'd like to mention is the idea of home care and the lack of appropriate human resources in home care. This is a vexing issue in Canada that I would argue has not received anywhere near enough attention, perhaps because those who receive home care are, to quote a paper on this topic from a while back, neither seen nor heard. We hear about hospital emergency departments closing in the news, but rarely around parts of the country, many parts of our country that have no home care resources, and even less so as it applies to children. Each jurisdiction in Canada has disparate funding sources, policies, shortages of qualified providers, and other systemic issues. All of these are critically important, but I'd like to highlight the importance of family choice. We have seen really successful pilots of giving family caregivers discretionary funding to purchase more services from unregulated providers rather than fewer and often unavailable services from licensed healthcare providers. And families are best able to assess the fit for their child without relying necessarily on the formal healthcare system. And lastly, building upon this, I want to highlight the importance of relationship and partnership. We just completed an evaluation of a large complex care program in Ontario that measured the outcomes related to receiving care from a dedicated team that was focused on the holistic needs of children with medical complexity and their families. We compared the outcomes from those who received the services and those who do not receive the services right away, using a framework for assessing outcomes that was developed together with families in the program. An interesting finding from this research was that we did not detect changes in some of the outcomes until 2 years after families were enrolled. And I think this speaks to the importance of trust, relationship building, and mutual respect in all of this work. Care supports aren't a one and done activity. It takes partnership between families and teams. It takes time. It takes attention. It takes patience. But when it's done well, it can have profound impacts. Maybe I'll stop there and look forward to interesting discussion with my colleagues.
Thank you, Eyal. I feel like we should talk more. You're speaking so much to the demographic that I am from, and there's you've done so much work in this area. It's incredible. Yeah, I almost feel like we really have gone through. My first question was about why it's important, and I think we have talked about why it's important here, and maybe we can talk more about, move into the second question and talk more about what those, some of them have been touched on as well, but what those policy solutions, what we could do. Again, talking about flexible, inclusive, accessible support. And we've talked about, room for children, a welcoming, inclusive space in typical childcare centers. We've talked about the need to expand the care support through to the age of 19, and about kids who have specifically, high health needs as well. And maybe we can just talk about some of those solutions, things we're seeing in other jurisdictions, and what this could look like if we did this all better. And I'll invite whoever would like to talk into that to start.
Maybe I can kick things off on the childcare front. I think it's worth pointing out, I haven't looked in great detail about children with disabilities. Clearly, there's going to be additional challenges there when it comes to childcare. One of the things that's fairly universal outside of PEI in Quebec is that there's not nearly enough spaces for anyone. So it's not as if there's a shortage particularly for children with disabilities in comparison to other groups. There's not enough spaces for anyone. And so there will likely be a big construction of new spaces, and how that construction really matters because it will lock those spaces in. If you've got a big expansion of childcare spaces that are not accessible to children with disabilities, that's going to be the case for a long time. And it's going to happen over the next couple of years. Much of this isn't actually happening federally, although it's being funded federally. These decisions are being made provincially. And so what provinces decide and how the expansion happens provincially will very much dictate accessibility in the future, broadly speaking, but also more specific for children with disabilities. That's certainly true on the physical construction of spaces, but also on how likely it is that childcare centers can retain staff with specialties. And so insofar as you've got staff that have early learning and childcare credentials, and also some sort of overlap into help with children with disabilities, you're going to have to pay them more. And so insofar as you're able to do that or not able to do that due to provincial policy, will really sort of dictate in this expansionary phase whether children with disabilities are included in that expansion. And so there's a lot of debate around, do we just throw some money at a chain of childcare centers just to build the mini mall of childcare in big cities? That would absolutely reduce the number of deserts. But again, they'll choose where they think it's best and provide services to whom they think is best to maximize their own benefits, as opposed to a public planning process, which is certainly what I'm advocating for, that would include features like, where should we build these new spaces? What should these new spaces look like? What are some other considerations around accessibility beyond just geography, which is quite important, like children with disabilities, like parents who work shift work? That I think is going to be a real expanding discussion, and it's going to happen soon. And so I think it's certainly well worthwhile discussing it within the context of children with disabilities.
Absolutely. Thank you, David. It's critical timing that we do get our voices to the front of those conversations. There's infrastructure being built and there's workforce strategies being built. And that is, it is critical timing. And there's opportunities. Interestingly, I heard other parents of typical kids advocating for support, maybe for family choice. So the support going to the family. So right now, you might not be able to accommodate all kids because of capacity at childcare centers, but there are opportunities to directly support families immediately with direct funding. Erika, I feel like you're ready to speak.
Yeah, thanks. Yes, I was gonna raise my hand. Added. I think it's a multi-layered, because all these things need to be tackled, and so that's what makes it sometimes complex or hard to follow all the threads. But what we've been hearing, and one of the our campaign at Inclusion BC, it's called Kids Can't Wait, when we're talking about the early intervention supports, and that is the entry point and has been kind of expanding. But what we heard from community consistently is that family-centered approach, child-centered, like the child of the needs of the child at the center, and how to bring in and really the siloing of systems, because that is one of the greatest barriers. So I think in terms of the advocacy work to move this dial is to also bring the awareness that it's not the work only of one ministry in any province. And it's true, like some federal funding is coming through, but the actions are going to happen provincially. And in BC, we see that, and I know that this experience across the province as well, that each ministry looks out for their own budget line. So we need to bring all those budget lines together, right? In making the design, if we're designing new places, nothing prevents us from doing a universal design right at the get-go. Show that children, all the needs of children, are considering an opening and a space. And I really want to emphasize that one of the big pulls that we need to do is to have a legislated inclusion, because right now, like, the optional part is not appealing to the kindness of the heart to make sure that your rights are respected or implemented. It's not a right way to go. Right, like we need commitment, and that legislation will bring budget lines along to say, like, okay, if we have to include everyone, what is needed, and then how that is budgeted for. And I also want to, I think what the diversity of implementations across the nation brings us to look at what are the current mechanisms for inclusion, right? In British Columbia, we have something that is called the Aboriginal Supported Child Development Program, or Supported Child Development Program, to support the access for additional support. It's uplifted in terms of funding to the level of giving more access to children. And it's been given in different levels across the province. So we have this proportion. Some regions are more impacted in terms of how less they are receiving to uplift this program. So while that might not be the ideal, it's what are the current structures like that we can look for uplifting and having more resources attached to it, while there are other ways that are being early childhood educators, how post-secondaries are responding to the training needs. If we consider that disability is a natural part of life and all childcare centers can have can have the possibility of having a child with a disability at their center, that is not for an optional program. That needs to be embedded in the core curricula of the training of an early childhood educator. And with that, the wage grid that is some of the work that is happening in BC and looking at the wage grid and doing that next step. So it helps because all these lines are going to be able to uphold a system that will be welcoming for all their children.
Thank you, Erika. Yeah, it just made me think as well through the work I'm doing federally. I'm also hearing the ratios in childcare centers, essentially a lot of the stress and the inability to retain childcare educators, that low wage and those ratios in childcare centers that do not allow for the consideration that every childcare center will have children with disabilities or developmental delays, some kind of support needs. Those ratios do not match the need. And that is part of the problem. And we can't let that problem lie with the children. That problem lies with the system. And anyway, great conversation. Thank you. And I wanted to invite Eyal in, just thinking about other jurisdictions, what we're seeing. There's been some interesting conversations lately about family caregiver pay in the US, that whole movement gaining momentum. We've been talking about the need for a caregiver benefit federally here. I would love to hear your thoughts.
Yeah, I want to build upon something Erika said. So what, it's quite clear what needs to be done, and sometimes it's useful to think why it isn't being done. And some of it is a human rights issue of a lack of inclusion of individuals with disability in policy planning. Some of it is actually, I think, structurally related to the complexity of governance. And almost universal to many of the issues we've been discussing is this idea of cross-sectorial relevance, right? If you are talking about, for instance, the topic I spoke about, like caregiver support, is that health? Is that social services? Is that finance? And it often crosses multiple jurisdictions, and that's not the comfort zone, I think, of policymakers, where it's much easier to compartmentalize something. So the topic I spoke about, which is on the concept of how we support caregivers writ large, that's a really good example of one. Like, health is in a really crowded place now of things that people are pushing to try to fund that we haven't funded traditionally: dental care, drugs, lots and lots of things that aren't in the Canada Health Act. But to move from that to caregiver support, it's just not the path of least resistance in policymaking, even if you take aside all the human rights issues and the burning platform that I think exists. There, for a long time, has been a cry for a national caregiving policy to frame a caregiver benefit and other policies that would then flow from that. The Canadian Centre for Caregiving Excellence has been pushing that for quite some time, and it's been a challenge. It's interesting, just last month, south of the border, which most of us would not look for as progressive social policy lab, actually the Biden-Harris administration issued an executive act that would have national support for short-term respite for individuals with dementia. So there are examples from other jurisdictions where this happens. But part of it is finding kind of that window of opportunity. And the one piece I just want to speak about from my experience interest in this population of children with complex care needs is the importance sometimes of partnering with other advocacy groups that aren't necessarily in the exact same space that I'm in, but nevertheless have a lot of shared commonalities. So the Burning Platform in caregiver support isn't at the moment caregivers of children with complex care needs. It's caregiving of the huge population of aging Canadians who rely on unpaid caregiving for so much of their needs. And that system, as everyone can appreciate, and as anyone who has seen what's happened in the last 3 years during the pandemic, has been hugely stressed and very underfunded. So sometimes finding that commonality with another burning platform where it's not exactly the same thing. We're not talking about childcare. We're not talking about school-based supports. We're not talking about exactly the same ideas, but still, I think that umbrella is often a helpful one to join in, or to develop a unified voice about ways of moving policy forward.
Absolutely. Thank you, Eyal. And actually, yeah, that particular group, if you're speaking of the Caregiver Center for Excellence, they are welcoming our demographic into their discussions, which is great. Erika, it looked like you had something to say, and then I think we need to wrap things up.
Oh, all right. Yeah, I just wanted to add to what Eyal was saying in terms of that those lines of partnerships are so critical. And for example, the Caregiving Center is speaking about siblings, right? We've seen it in how, because a child exists with a family, oftentimes has siblings, right? And not all of them, but in how we're building those networks and recognizing that can be supported. So I agree in that part. And at the same time, when you said the why this is happening, Eyal, it brought me back. One of the things is that we've consistently inherited an institutionalization mindset, right? When we say oh, your child has a disability, there is the specialized place, the specialized people, the specialized all of this that will take care. And what is shocking is when you talk to a person who has no direct connection, who with this unique needs, and you tell them that their parents don't receive all these supports, they are shocked. There's wait a minute, aren't we in Canada? It's yes, exactly. So I think they're raising the awareness. I think we needs to raise them kind of that links that that will kick people and say how is this happening in my country? Right. And there's a lack of awareness and the assumption that is happening on one side, and on the other that it's this continued idea of institutionalization that looms over, right? I'm going to be taken care of in this facility. Eventually they will go X, Y, and Z. So we don't envision rich lives in communities and with the supports and the network around them. And I think that is a part that we need to continue emphasizing in the spaces that we go, to call it as it is, to bring awareness. What is the lens that we usually see people with disabilities through? And then breaking that stigma, which would be the ableist perspective, to really engage in designing those inclusive spaces and respond to that and continue with those. I totally agree that partnering with other advocacy, it's incredible that being one, the number of people with disabilities, and when we talk about children, that it's so overlooked. But I think there's a huge assumption that it's being taken care of, and that's not what's happening.
Thank you, Erika. It is so true. It is the general belief. Thank you all so much. We could talk for hours. I think we all need to get into a room together another time and continue this discussion. But thank you so much for being here. And I am going to pass it back to Amanda F. Thanks all.